Hello, and welcome to a Place of Safety podcast.
Hello, hi, with a question mark in the end.
I'm Matt.
I'm Vincenzo.
So, Vincenzo, why don't you tell us a bit about your idea for this podcast?
Okay, so the basic idea behind this podcast is that to discuss issues related to mental health care or the care sector in general in Britain, it's very difficult to do it within services. For a range of reasons that we will explore in this podcast.
Right.
And this is, I think, relevant for both people that are working in the system and people that have been or are helped by the system.
Yeah.
And we want to have a space for these topics that are not discussed in services, that are not discussed in training, to be discussed.
Okay.
So give a platform for different ideas, basically.
I know you've been thinking about this podcast for a long time. Maybe you could talk a bit about what's prompted you to want to make the podcast.
Okay, so basically, I started realizing that I wanted to do something about let's say, creating this platform when coming from Italy, so coming from a different country. I was trained in Britain, and I was told to do things that were the exact opposite of what I had been trained to do in Italy, without any possibility of explaining why I disagreed.
Yeah.
Without any possibility to discuss this, just you need to do things differently.
Sure.
And
so you've come over from Italy to Britain, and you've seen a problem in the way that we practice things in the UK.
Well, yeah, I've seen. I think I would see problems in many places, including Italy. The problem is not what's pushed me to try and organize something was not the fact that there were things that I didn't like, but the fact that there was no possibility to discuss the basis of the system, the premises of why we were working in a certain way.
Okay. And so this is the reason for the podcast. It's a place to discuss those ideas.
Yes, it's a place to discuss those ideas. And I think another reason that pushed me to do this podcast was the fact that while the establishment and the, let's say, the standards training in different services that I work for pushes for a certain view, individual people in the system don't have these strong views about how to do things, and would be rather happy to listen to different perspectives.
Okay.
So I think there's a lot of potential to start a conversation, and I think there's a lot of ideas without coming from Italy, even staying in Britain, talking to people in Britain.
Yeah.
People have different ideas that are not represented.
So do you think that conversation's not happening at the moment?
No, it's not happening at all.
Right.
And that's why I decided to do this, but also and while thinking about how to approach this, I thought that we needed to start from the most basic level.
Sure.
To explain my perspective, our perspective from the beginning.
Okay.
Our perspective, because there's also you.
there's also me.
I'm not the only one.
You're not the only
one. So we thought that the best place to start from is the concept of best practice.
Yeah.
Because it's a very basic tool, let's say, that the system has to prevent debates, at least from our perspective, inside services.
Okay, maybe you could talk a bit about what you mean by best practice.
Yeah, so best practice is the motivation behind policies Although now it doesn't surprise me at all.
Mm.
It really surprised me in the beginning because when I came again from Italy, I knew there would be a different system. I knew that I could have issues with certain things,
Mm.
but I didn't expect. I expected to be able to discuss these issues.
Mm.
So I would there would be a policy procedure that I would have to follow,
Yeah.
and I would say, okay, and why do I need to do this? Because it's best practice.
Sure. And that's not something that you came across in Italy,
That's
for
not something that I
example.
came
No.
across in Italy. It's not something, by the way, that, as we will see, it's not something specifically related to mental health generally, the concept of best practice.
Sure.
But what I found is that I didn't agree with the fact that that procedure or a range of procedures and ideas were the best because they were the exact opposite of what I had been trained in.
Sure.
So they were asking me by saying, you need to do this because it's best practice,
Yeah.
to just give up everything that I had studied, and I qualified as a psychologist in Italy, so I studied many years.
Sure.
Um, 2 university degrees and just give it up completely because now this new thing is best practice.
Yeah. And why do you think we've aligned at a place where our two countries have such different systems and they don't?
Well, that's a long story, which we will discuss in the future. In one of
In the
the
future, okay.
in one of the episodes, we'll dedicate many episodes to different things.
Yeah.
But there's different histories in Britain, in Italy, but also in other countries. It's not as if Italy is the only country
Mm.
that has a different system from Britain. France has its own system,
Mm.
its own history. Institutional psychotherapy is a movement that had a lot of influence in France. Germany has its own history, etc. And I don't know much about all of these different places really, but I am aware that if I went to live in Spain or wherever, that I would find different ideas, different perspectives.
Sure.
And this awareness doesn't seem to exist in the establishment, in the system.
Yeah.
They seem to think that their view is the best, and that the whole world needs to believe that their idea is the best.
Right.
Now imagine if this was applied to politics.
Yeah.
If a politician says, well, we're going to do this, and why? Because it's just the best opinion.
Sure.
People would not accept that. People would think that's ridiculous.
Yeah.
You need to provide reasons behind it. And very often this doesn't happen. Best practices are self-evident reason to do stuff.
Sure.
You need to do it because it's best practice.
Yeah. I think in some of my experience, so I've encountered practitioners who have said that, best practice like changes over time and it, responds to needs, changing needs, and if they realize that something doesn't work, it changes. But that is a way of like unifying and making sure, without using legislation, that people are working
in the same way,
or in what is to be like, a good way.
Yeah, and exactly in the same way. It's very institutionalizing that everybody needs to work in exactly the same way.
Yeah.
And you say, well, it changes. It changes, but not because people have a chance to discuss it and there's an ongoing debate. It changes because those at the very top of organizations decide that everybody else needs to believe in something.
Sure.
So if you don't allow debate, change can only happen in a very top-down direction.
Yeah.
It's different to say, look, we're working from this perspective, which I have no problem adapting to a different perspective. Somebody says, well, we believe in this. I might say, well, I disagree with this, but I'm fine. I want to see your way of working, but I would like to be able to ask questions. Now, if you ask questions and you start a debate, then you improve services. When I was in Italy, specifically in Trieste, Trieste is one of the best mental health services in the world. It's got a lot of international recognition.
Okay.
But with my supervisors, I had ongoing discussions about what we were doing. Critical discussions. So it's not as if I agree with everything that happens in Trieste. I was constantly discussing, why are we doing this? I don't think we should be doing this. And I would be getting questions, why do you believe this? What did you not consider this other thing, or what? And this is impossible in Britain. It's just it's possible here. It's possible with colleagues on the same level, but if you go in training and say, well, I don't agree with best practice, that's not welcome. That's not seen as, oh, this person is.
Sure. So talk to me about, so in Trieste, when you would have a problem with the way something was done, what would happen? So you would take it to your like manager.
Oh yeah,
and you
well,
would say, I disagree with
so
this.
I was in Trieste. I did two internships, training as a psychologist, and then I volunteered many years,
Right.
2 3 years. And I would ask the question, why are we doing this?
Yeah. And what sort of response would you be
well,
met
not
with?
because it's best practice, definitely.
Okay.
It would be because whatever, because or would be another question would be, well, what would you want to be doing?
Okay.
Say, well, what about if this happens? What about
Yeah.
if that happens?
So they would engage in a debate with
They would
you.
engage, I think, in virtually in every service that I've been.
Yeah.
People that were supervising me would engage in conversations, because that's what training is about.
Yeah.
So that you're supposed to discuss things.
I suppose what I'm interested though is, what was the result of those conversations? Did that result in the change to the policy, or?
Well, the thing is, there's no chess works in a different way. There's no specific policies. You need to say this to this person.
Okay.
It's a different type of work. So it would be built in a less prescriptive way.
Sure.
So you would be told, you would be you've studied at university. You would say, okay, well, here's your group. I was volunteering with a group of young people, for example. And the idea would be, you would be there and you would be, engaging in activities, and you say, well, if you want to organize something. And then as things happened, you would say, okay, hold on a second, but why you haven't told me who's one thing that happens a lot in triage, who's the patient and who's the psychologist here? I don't know, I just see people. So why do you need to know who's the patient and who's the psychologist? So that's how the conversation starts, and that's how then you build a structure. It's not a prescriptive structure. There's a lot of emphasis in Britain of having a very prescriptive agenda of, you need to say this, you need to say that, and that it would be not structured to have just a conversation with people.
Sure.
And that wouldn't help people in some way. Whereas there's a lot more structure that can emerge when you can actually express yourself in the way you want to do things.
Yeah.
Right? To a certain extent also. If you think, well, I want to punch people, want to punch patients, that doesn't work, right?
Yeah.
But yeah, if you standardize care, if you say, no, everybody needs to do this procedure, that is really very institutional, and it stands for, and we'll get into this in the future, the fact that British mental health care was originally based on the asylum system, like everywhere in the world, really, more or less, that I know. But it never really challenged that view. So the asylums were closed because there wasn't enough money, not because they were considered horrific places.
Yeah.
Although somebody considered them horrific places. It was the Thatcher government that closed them down and started that process of care in the community, etc. But so you see then this culture in services when you have these policies that everybody needs to follow and nobody can question.
Sure. So you think this culture has come directly from the closure of the asylums and into?
Yeah, I think the culture of institutionalized care never left the UK. And not just the UK.
Sure.
And I mean, again, I'm saying I don't think that Trieste, Italy, which by the way, Italy generally has many services in Italy are rather underfunded and bad, actually. Trieste is an exception, really.
Okay.
Unfortunately, in Italy, of a really good service.
And why is that?
Well, because I think, I'm not the most qualified person to say this, but partly because of the history of Trieste, because the reform movement didn't start in Trieste, but really developed in Trieste into a system, the only system in the world, Italy, without psychiatric hospitals.
Sure.
But